Hi, Dr. Ashley here with the Allergy and Asthma group of Galen. Today I wanted to discuss food allergy symptoms. I want to start this off by saying we are still learning a lot about the world of food allergies and that each patient is different. So a lot of what I'm going to describe today may not apply to you, but it does for the majority of patients according to our research and the training that we've undergone as allergy and immunology specialists. Let's just talk about what a typical food allergy is first. So a food allergy is when your body, for some reason, develops antibodies, which are shaped kind of like a fork, which is why I throw my fingers up like this, to a certain protein in a food. If you have these antibodies in your body, typically they're called IgE antibodies, when you eat that food, the antibody will fit and click with it and then cause an explosion of chemicals in your immune system that causes these symptoms of food allergies. Typically, the onset of symptoms is fast, so most patients with a true IgE-mediated food allergy have symptoms that occur almost immediately or within minutes. Now that can happen up to an hour later, sometimes two, and there are some uncommon ones that can present with delayed reactions hours later. But for the most part, a true food allergy is not going to have symptoms present the next day or the next or even a week later. Secondly, a true food allergy usually gets over with fairly quickly. Symptoms don't last for days at a time. However, they can be severe. So a person with food allergies either gets help quickly or their body gets over it on its own, which we don't recommend. We recommend getting medical help very quickly if you're suffering food allergy reaction, but the symptoms don't go on for days and days at a time, typically. And so let's dive into some of the actual symptoms. So starting from a head down approach, I like to think of lightheadedness and dizziness, and that can be due to a drop in blood pressure. Your eyes can become red and itchy and watery. Your nose may start to run. Your mouth may become tingly. Certain areas of your skin, like the eyelids and your lips, may become swollen. Your throat may actually start to become swollen as well, leading to a feeling of choking or not being able to swallow. Moving into the chest, you may feel short of breath or like your chest is tight, and that's because the lungs are starting to clamp down. In the belly, if you're a female, you may feel uterine cramps, but also nausea, vomiting, and diarrhea can come along in anyone that's experiencing the symptoms of a true acute food allergic reaction. And lastly, on the skin, there is usually some kind of skin reaction like hives or flushing. This can be in just random spots, or it can be all over the body. So what do you do? Number one, you come see an allergist immunologist if this has happened to you, so that we can talk through it with you and either confirm or consider refuting and clearing that allergy for you. We also want you to have the right tools on hand, such as an EpiPen to use in a dangerous situation, because that can be life-saving in the event of a food allergy attack. Now, although those are all fast, quick, what we call acute symptoms of a true food allergy mediated by those IgE antibodies, that doesn't mean that foods don't cause other symptoms. It's just in our world, we wouldn't label those as an allergy. One of the most common ones is lactose intolerance. Other folks can have gluten sensitivities, celiac disease, and many other side effects that are caused by foods. And so when you come to see an allergist and we say, hey, we don't think this is a food allergy, we don't mean that your symptoms are absolutely not caused by foods. We just mean it's probably not one of those IgE-mediated, super dangerous food allergies that we worry about. That's what our testing is designed to pick up on, are those antibodies. And so if it doesn't sound like a food allergy, we may not even recommend our allergy testing for you. Anyways, I hope this has been helpful for you. Take care.